Hello, my name is Dr. Mustafa, and today we are going to talk about ECG, which can be a really confusing topic. But trust me, if you pay your full attention and try to grasp this idea, I will assure you that you will be able to get most of the abnormalities, and you can definitely pick out what's wrong, and you can escalate that to your seniors to save lives eventually. So let's have a look into it. So ECG is basically a graphical representation of electrical activity of the heart or myocardium, which is basically the muscles of the heart. So there are basically different nodes and different wiring in the heart that carries the current or electrical signal from one point to another. It is really important for us to know that, as through an ECG we can look for an ACS, which is an acute coronary syndrome, that can indicate like myocardial infarction, angina, cardiac arrest. We can look for the electrolyte abnormalities, for example hypercalcemia or hypocalcemia or hyperkalemia or hypokalemia, which is potassium or calcium level, and other as well. Another important thing is we can look for any cardiac manifestation of non-cardiac diseases, for example pulmonary embolism. There could be some metabolic disorders, and there could be some lung associated diseases as well, and dysrhythmias as well. We can see through that we have like bradyarrhythmias, tachyarrhythmias. We will talk about them as well. So let's dive into it, and please pay full attention, and once you understand these basics you will be able to pick up all the abnormalities one by one. Let's start. So a typical ECG looks like this. It is a wavy thing, and it has different segments, intervals, and a QRS complex, which we will be talking about in a minute. So it has waveforms and segments, most importantly, and we have intervals as well that start from that. We can see like we have PR interval and Q2 interval. We don't really have to dive in too much into that. Let's stick to the basics first. So in the waveform we will be looking for P wave, QRS complex, we know that, and then we have T wave as well. So these are really important, as they will indicate different abnormalities as we talk through. So that bump is the P, that downward notch is the Q wave, the upward notch is the R wave, and the S segment is the downward notch, and then we have the T wave as well. Then moving on, we have segments. So we basically have two segments here mentioned. The one is the PR segment, which is really important, and the other very famous one is the ST segment, which is also very important. So we will talk about them one by one. This is basically when you look at a wavy thing and you can name it, like what is what, who is who, like it will make it easy. So now moving on to what are the things exactly that we are supposed to see and calculate when we are looking at an ECG. So first of all, for an evaluation we need to look for mainly five things. That is rate, it could be normal, it could be tachycardia, it could be bradycardia as well. I know these are the names that you must have heard a couple of times. So a normal heart rate would be from typically from 50 to 100, and for tachycardia it's more than 100 beats per minute, and for bradycardia it would be less than 50 beats per minute. So the next thing that we will be looking at is the rhythm. So it can be regular or it can be irregular. We basically see that if it is regular or not based on the R peaks. We see if the distance between two different R peaks is constant, then it is regular. If it is changing more or less, then definitely it's irregular. Next thing is P wave. We will look for that, is it present or absent in an ECG. The fourth thing that we will be looking at is the QRS complex, and in that we will be basically looking at, is it narrow or wide. So there is a small criteria for that. We will talk about it as well. So, and then the final thing is the ST segment. We will look for that. Is it elevated? Is it normal? Is it depressed? As even slight changes in this segment can indicate severe MI, which is myocardial infarction. And there are some of the very famous terms that you must have heard, like NSTEMI and STEMI, like non ST elevation MI and ST elevation MI as well. So these are just basic terms that you should know. Let's move on to each step one by one. So first of all, we will move towards rate calculation. So how are we going to calculate a rate? Let's see. So the first thing that we will look for is the rate. So for that we will see if the ECG is regular or is it irregular, because we have different formulas for different kind of ECGs. These are basic too. So for the regular one, the heart rate can be calculated by simply 300 divided by number of big boxes between two R peaks. And here is a rough ECG if we can see it. So let's say these two upward notches are R peaks, and the number of boxes, that is big boxes, between two R peaks, we can just calculate them and divide 300 by that. So for the irregular one, we can use a different formula, which is this. So here are like the big boxes, and it has small boxes in it, and then there will be another big box next to that, and we will basically calculate the number of big boxes like S1 or 2. So for the irregular one, we will calculate the heart rate by number of R peaks in 30 such big boxes, and we will multiply it with the 10. That's quite simple. So if an ECG is irregular, we can calculate heart rate with this formula. So these are the basic two formulas that you should memorize them. These are quite easy to understand and quite easy to remember as well. So let's practice some of the rate calculation. So we have these two ECG. Let's look at the first one. So we can see that the R peaks are at regular distance from each other. So we can say we can use the first formula, which is 300 divided by number of big boxes between two R peaks. So there are 8 boxes. You can calculate it by pausing the video. So if you calculate it, it is almost 50. So we will get the heart rate of 50 from that. And moving on to the next one, we can see that the R peaks are at not equidistant. So we can use the other formula for that, which is we can calculate the number of R peaks in 30 boxes, or we can say it for the 6-second lead, and we can basically multiply it with 10, and that would be almost 140, which is more than 100, and it makes it tachycardia. And the upper lead shows the heart rate of 50, which is almost on the edge, and it would be kind of bradycardia, we can say that. So that's how we calculate heart rate. So that's a simple example. Now let's move to the next point, which is rhythm. That is, if we can go back, so in the rhythm we need to see if it is regular or irregular, as we have already discussed it. We need to see the R peaks. So let's just calculate it from there. We have two ECGs here. So the first one, we can see we have almost 1 2 3 4. We have 4 boxes between each R peak. So the first one would be regular, and just look at the second one. So in the first one we have like 3 boxes, and the next we have 2, I'm sorry, 1, and then we have 3 again, then we have 2. So it makes it really irregular. So that's the simple way to say this rhythm is irregular. That is based on R peaks. So now let's move to the third thing that we need to see, which is P wave. So about the P wave, we need to see for 2 things. Is it present or absent? Let's look at the first one. So we can see that in the first one, P waves are present, and in the down ECG, we cannot see any P wave. There is only one bump, and it means it's absent in that. So the fourth thing is for the QRS complex. So for that we will be calculating number of small boxes that are in the QRS complex itself. So it can be narrow complex or broad complex. If the number of small boxes is less than 3, it is narrow. If it is more than 3, it is broad complex. So if we look at this ECG above it, we can see these are like, that doesn't make sense, and it is quite wide, and if we can look closely, there must be like more than 3 number of small boxes, and that make it a broad complex QRS complex. So if we look at the previous ECG, just look at the second one. So here it is still as a lighter background, but it has like less than 3 number of small boxes in a QRS complex. That is a good example for narrow complex. So based on this knowledge, we can comment on the rhythms, and we can find out if there is any arrhythmia going on, and we can see if it is an bradyarrhythmia, which is kind of heart block, or is it tachyarrhythmia. So for the sinus rhythm, we have different categories. It could be normal sinus rhythm, it could be sinus bradycardia, it could be sinus tachycardia as well. And next thing is bradyarrhythmias, in which we have first degree heart block, we have second degree heart block, in which we have two categories like type 1 and type 2, and then we have third degree heart block, which we can also call it complete heart block. And moving on to tachyarrhythmias, in which we can have narrow complex and the broad complex, and there are many further types in it, which we will be discussing in further videos, as it is not possible to talk about all of them in one go. So let's do a test. So here is our first example. Let's go step by step. That we need to see rate, we need to look for rhythm, QRS complex, and P wave as well. Of course we need to look at the ST segment as well, but for the sake of rhythms we need to look for these things in particular. So let's look at the rate. It's regular, so we are going to divide 300 by number of boxes, which is 4. That would be make the heart rate 75, which is normal heart rate. And now looking at the rhythm, as we can see there are equal number of big boxes between adjacent R peaks, so it is a regular rhythm. So looking at the QRS complex, so it is normal as well. Then moving to the P wave, yes, we can see the P wave, it is present. So based on all these things, we can say that this is a sinus rhythm. Now just take a look at this. So we will be doing the same thing. Let's calculate the rate first. So it's regular, so 300 divided by 8, because there are 8 boxes, so it's less than 40, which means it is bradycardia. Okay, so the next thing that we need to look at is the rhythm, which is regular. And let's move on to QRS complex, and it is normal as well. Let's look at the P wave. Can we see that? Yes, it is present. So based on this is basically, we can call it sinus bradycardia. Now let's move to the next ECG. So we have this, we will be following each step as we discussed. For the rate, we will divide 300 by 2, which will make it 150, as the rhythm is regular, sorry. So the heart rate is 150, which is obviously more than 100, that makes it tachycardia. And the next thing is rhythm, which is regular, because they are equidistant between each R peak. And then we have QRS complex, which is normal as well, as they say. So the P wave, we can see that it's there. So this makes this whole thing as sinus tachycardia. Now let's look at this next ECG. We can see that it looks a bit weird, but let's follow the steps and let's see what we find out from this. Okay, so first of all, it is regular, So the rate formula would be 300 divided by number of boxes. So it seems like it's less than 2, but we can definitely say 2. Let's say it. So that will make it 150. So yes, the heart rate would be 150, and that makes it tachycardia. So looking at the rhythm, we already know it's regular. And then moving on to the QRS complex, so which is narrow, and moving on to P wave if we can find any. So we can see there is no P wave, so it is absent, as there is only T wave in the ECG. So in this case, with a heart rate of like more than 150, we will call it supra-ventricular tachycardia. We normally say it if it is more than 180, then we can call it SVT. So that's it for today. There are more irregularities or abnormalities like this that we will be discussing in further videos, as it is not possible to compile all this in just one. So if you have any question, just let me know in the comment box.